This week on the ASC Podcast with John Goehle, the Ambulatory Healthcare Strategies team discusses the ASC industry's biggest annual event, ASCA 2018 in Boston, Massachusetts, and their biggest takeaways and funny stories. And as we do each week, we provide an update on the latest news in the industry.
Welcome to the ASC Podcast with John Goehle, a weekly podcast for anyone interested in the freestanding ambulatory surgery industry. This week's episode is sponsored by Ambulatory Healthcare Strategies, one of the nation's leading full-service ASC regulatory compliance consulting firms, and the Regulatory Compliance series of books for ASCs by John Goehle and published by Eden Group Development.
Welcome to episode 16 of the ASC Podcast with John Goehle for April 16th, 2018, recording from our studio here in Rochester, New York, with remote segments from the Heinz Convention Center in Boston, Massachusetts, and the ASCA 2018 conference. This is Jenna Alvarez, Senior Nurse Consultant with Ambulatory Healthcare Strategies, and I'm here with Sue Cronkite, also a Senior Nurse Consultant with AHS, and John Goehle, the owner of Ambulatory Healthcare Strategies and one of the nation's leading ASC industry experts in regulatory compliance, finance, and administration. John is also a deemed status surveyor with one of the major accrediting organizations and the author of over 10 books about the ASC industry. Welcome, everyone.
Welcome.
Thank you. Welcome.
And everybody awake?
Yeah.
So, Sue and John, we got back pretty late from the ASCA conference last night and just in time to have a major ice storm here in Rochester. And of course, John and I are now going to be heading out again in a few hours for New York City to see one of our clients. So, you got to enjoy this weather for our driving.
I think it was 70 degrees when we left Boston.
Right.
And then we ended up 28, 30 degrees by the time we got home in that 6-hour drive.
We could actually see it going down 1 degree at a time every time we...
every few miles.
Every few miles.
Okay, and John, you were quite busy at the event. What was your take?
Well, ASCA 2018 was by all measures a great success. This year's conference was very well attended, and I had an opportunity to interview an ASC Association staff member about the attendance. Before I roll the interview, I should note that our live recordings during today's podcast are quite a bit different in quality from our studio recordings, and this recording is particularly difficult because of the background noise. But here it goes. So I'm here in Boston, Massachusetts at the Heinz Convention Center at ASCA 2018, and I have with me Jason Hawkins, who is the Information Systems Manager for ASCA. Jason, as I walk around, I've had an opportunity to speak to a lot of the attendees here, and universally they told me what a wonderful conference this has been. So from those measures, everything is doing well. It was a great conference, but you actually have some statistics for me. So can you tell me a little bit about the attendees, the exhibitors, and who attended and how well this show has been taken?
Sure, it's been an amazing year. I mean, we've had approximately 2,200 attendees. We've had a good on-site showing of walk-ups to the registration counter. We've had about 170 of those. 200 exhibitors in the exhibit hall. It's been one of the best exhibit halls in the history of ASCA meetings. I think it was a very, very vibrant, very much more larger, engaging exhibit hall that I remember in recent history.
And I can speak to that also, given how sore my feet are, just from how much we've had to walk around to each of the different areas to see the different exhibitors. Now, I attended a couple of sessions where I heard interpreters in front of me. So I understand that there were quite a number of people from foreign countries here. Can you tell me a little bit about that?
Definitely. I mean, we had representatives from Hong Kong and Canada, but the interpreters were here. This is the second year they've done this program. It's the Special American Business Internship Training Program. It's run out of the U.S. Department of Commerce. And they brought 20 representatives from mostly Eastern Europe, countries like Georgia, Russia, Moldova, Kazakhstan, Ukraine, Uzbekistan, and some of them, not all all of them, but some of them were actually repeats from last year. So they enjoyed it so much last year that they made the trip back to the States this year specifically for this.
Wow, this is incredible. It's incredible to see perhaps what happens in those countries as they start to take this information back to their own areas and do something about it. Thanks, Jason. I really appreciate your time.
You're very welcome. Thank you for having me.
We also had an opportunity to meet a lot of you, our listeners, and we were quite overwhelmed by your support. Some of our listeners asked how we choose our topic of the week and if we were willing to take suggestions. So we're going to be much more specific about how you can contact us with ideas in the future. So if you do have any comments, suggestions, questions, please email us at comments@ascpodcast.com. That's comments@ascpodcast.com. So somebody asked us, how do we choose our topic of the week, which is always kind of interesting. Mainly the way we choose them right now, up until now, has been we kind of look at our last week and have seen what major issues or what types of issues were we running into during the week with our clients, and those would often become our topic of the week. But as we move forward, we're going to try to rotate through or cycle through the various issues surrounding or pertinent to an ambulatory surgery center and broaden our topic list also, where we haven't really done much on finance yet, and that will be a topic of some future podcasts also. One of the things that we found, or we are finding as we become more popular, is that we're being approached by a number of vendors who are always trying to find a way to get some free publicity for their products. So we promise you we're going to be very careful about who we allow to be in our podcast and to speak to you, and we're also very careful about the sponsors of our podcast and the products that will allow to be advertised on here. But that has been an interesting development here. As we become more popular, suddenly people are coming out of the woodwork asking if they can get some free advertising on our show.
John, as we were debriefing after the conference, you spoke about some thoughts that you were putting together into an article for LinkedIn this week entitled Changing the Way ASCs View Themselves. Can you explain your thoughts on this area?
Certainly. So every time I go to one of these conferences, I know both of you were saying the same thing, that, you really get kind of philosophical at some points, and you start to think about, what this industry means to us and what types of things we've been talking about and how it's going to affect our lives and our industry. And it just dawned on me as I'm watching all these speakers talk about quality, and really that was the focus of so many of the sessions. Correct? That we really didn't spend a lot of time talking about money. We were always talking about quality. We were talking about how do we better improve our operations. What can we do in order to become better at what we're doing? It's time that we start looking at our industry a little bit differently. I think for so long we've always considered ourselves to be the alternative to hospitals, and if you listen to all of the dialogue, so it just seems to me that we're no longer the alternative. We are the site that ambulatory surgery should be done, that hospitals now should be considered the alternative, that the ambulatory surgery industry has gotten to the point where we are the place of choice. We are the primary location that really most of the ambulatory surgery should be done. And that's where we would assume surgery should be done, and unless there are some reasons that a patient needs to go to a hospital, such as some comorbidities, or if the case is going to be longer, or whatever reasons that we already use for that. But we're no longer that second choice. We're the primary choice for that. And that recent USA Today article that basically said, as surgery centers boom, patients are paying with their lives. We all know that was a very poorly written, poorly researched article, but the problem with the writers there is that they were listening to the hospitals. They don't have a lot of information about ambulatory surgery, and they do make that assumption that we're an alternative to the hospitals, whereas I think we're changing that dynamic now. We really are living in a different world, and we ourselves are partially to blame for allowing that, because we spend so much of our time talking about how we're the better alternative. We're not the better alternative. We are the site that ambulatory surgery should be done. So I just encourage everybody out there to, think differently about the way we do things, to remember that we should be that primary site now, and that the hospitals are purely an alternative when all else fails and you can't go to the surgery center to have your surgery done. I don't know. What are your thoughts?
I definitely think that's true. And I think, like you said, to change our mindset, that we're not trying to be as good as the hospitals. We're just a better alternative.
Right.
People, in the surgery centers, they're very specialized. In the surgery centers, they're focused on generally a few different procedures. They're very expert at that. You're not being exposed to all the other things you're being exposed to in the hospital. People take a real interest in what they're doing. They're not part of a large hospital with all these different things that are going on. They take it personally. I think the employees, the staff, the owners, it's all very personal to them, and they do their best to really make it a good experience. And I do think it's probably people are finding that the experience they have there is a lot better than they would have in a hospital.
Absolutely. I think we just we need to get the word out about the quality. We know that our quality statistics are better than hospitals. We know that we're more regulated than hospitals. So it's time that we get that message out there. Sue, so what's new this week in the ASC news?
Okay, so last week we reminded everyone that to avoid a payment penalty for their 2019 Medicare rates, ASCs needed to complete a new form electronically via the Centers for Disease Control and Prevention's National Healthcare Safety Network, or NHSN, website to be eligible to report their influenza vaccination coverage, Medicare Quality Indicator ASC 8. That deadline for your organization's primary contact with NHSN to accept the new NHSN agreement was April 14th, 2018, but we were notified this week that the deadline has been extended to June 15th, 2018. Note, however, that the deadline to submit the data for 2018 remains May 15th, 2018, so don't forget to log in to the NHSN website to upload your data. All ASCs must submit the data by May 15th, 2018 to avoid payment penalties. Also, remember that the deadline to submit ASC 9 and ASC 10 quality data through the QualityNet website is also May 15th, 2018. As with ASC 8, all ASCs need to submit this data to avoid Medicare payment penalties. If you do not perform endoscopy procedures, you still need to log into QualityNet and enter 0. If you need more information about the ASC Quality Reporting Program or how to sign up for the programs, visit our website and go to the page for this week, episode 16. We have put some links up there to assist you. Florida's governor signed a bill in March that changes a number of provisions related to healthcare regulation, including a repeal of the Agency for Healthcare Administration's Risk Manager Licensing Program, or ACA. Effective July 1st, 2018, the requirement that ASCs have a licensed risk manager has been removed, and the licensing of risk managers will cease. Surgery centers, of course, are still required to have a risk management program after July, but the qualifications for the person overseeing the program has changed from licensure to qualification through their education and experience. All ASCs in Florida will have to evaluate their current program, making changes to their policies, and decide who will now head up their program. We also want to remind our listeners that the first quarter ASCA benchmarking data collection is now open. So if you wish to participate in this great benchmarking program, get your data together and go up to the ASC Association website.
Okay, so let's take a quick break and we'll return and discuss ASCA 2018.
This is John Goehle. I'm here at the ASCA 2018 in Boston, Massachusetts at the Heinz Convention Center. I have with me the entire staff of Ambulatory Healthcare Strategies, at least the clinical and the
everybody else.
The daily staff. At least the daily staff is here. So around the table here is Alex Borneman. He's Director of Operations for Ambulatory Healthcare Strategies.
Hello.
Jenna Alvarez. She's our Senior Nurse Consultant here. Say hi, Jenna.
Oh, hi.
Judy D'Ambrosio, Director of Educational Services, and she's been a podcast host over time. Say hi, Judy.
Hi, everybody.
And Susan...
Sue Cronkite.
and Sue Cronkite, another Senior Nurse Consultant with and one of the podcast hosts. And a new visitor with us is Lori Rodricks. who is I actually pronounced that properly for the first time in my life.
I was kind of impressed. Good for you.
And Lori is our Director of Clinical Services. She's not always on the road with us. She's one of our more part-time people, but she's very much involved in the Education Committee here with ASCA. And Lori, you and I were very much involved in putting this whole show together, so we're very proud to have seen that it's come off very well. So I would like to ask everybody a question. So what was, first of all, let's start with the question. What was your favorite session? Why don't we start with you, Judy? What was your favorite session so far?
The first thing I wanted to say is that I wanted to encourage people to come to the pre-session. It's offered pre-session, like before it begins. Because
the Wednesday, you mean? Yeah.
Yeah, and I really don't know if there's an additional cost. I'm sure there is, but it really was well worth it. I sat in a 4-hour Joint Commission session, and a wealth of information. I mean, a wealth of now more work to do, but a wealth of information. Like, I couldn't have been happier to have come early and sat in there. The speaker, I forget his first name. Wait, I can look. Hold that thought. Jay Afro was fabulous, and a lot of information. I've been to Joint Commission conferences that are run by Joint Commission, and I think I learned more from Jay in those 4 hours than I did in 3 days. So even though it's an additional cost, please really consider coming in for that pre-conference stuff because it's just invaluable.
Great. So that was your favorite session?
All the sessions have been fabulous. I mean, I hate to just pick one because I haven't been here in 2 years, but there's such an improvement in the sessions, in what's been offered.
In the choices.
Everything was relevant to everybody. The rooms were crowded. Yeah. People were excited. There was a major difference. I think it's been 2 years since I've been here, and there was a noticeable, obvious difference in the quality of the sessions that were offered. So it's kind of hard to pick just one.
So Lori and I are high-fiving each other over here because that really has been one of our goals here. It's so great. We should also point out that we're recording this on Friday morning, so there still is another day and a half of sessions to go. But we thought we would try to get this in since we have a tight deadline to publish on Monday. And we will be doing some additional sessions. We have so much to go over, so many things that were learned here, and a lot of good input from everybody. Sue, what was your favorite so far?
Probably the one I just came from, actually. Was learning from near misses and mistakes with Lori Heels. She had a lot of examples of different things that happened. She talked about back in, I think, 2013, somebody had attached the lower lock from the blood pressure tube to an IV line, and the patient actually died. And she just was pointing out how many, maybe people, if they actually fit together, how many people might have seen that before and just thought, oh gosh, I'm glad that didn't happen, but nobody changed anything. So just watching these things and, anytime you get something that's kind of like, oh gosh, that could have been bad, talking about it and trying to figure out a way to put things in place because so many errors happen in, there's 5, 6, 8 different times when it could have been stopped. And, right. If people just can not be afraid to admit if they've done something stupid or, almost made a mistake that, how many times we could maybe change things. It was interesting.
Right. I think that's one of the basic premises of of trying to report the near misses is try to find out if we can back it up one more step. Each time, that something happens, we can hopefully avoid whatever stress was involved in getting to the point where you almost did something wrong.
And I was in that session with you, and I was impressed in that she stressed. Now, when there is a problem, this is not the time to be punitive. This is not the time to say, oh my God, this was awful, never do this again. It's okay. How can we fix it right now and get through the problem you have? And then later, well, let's go by, why did this happen? And why did that happen? And go back 4 or 5 steps to find the actual root cause of the problem. Right. Rather than just, oh my God, you've made a mistake, you're out of here. And she put a lot of emphasis on that. I liked that.
Right.
Yeah. And even finding, seeing was it a knowledge-based, a skill-based, and in-depth on how your mind works at those times. You're doing it by habit because it's just so ingrained in you. Well, you deal with that in a different way than if it's something where maybe you need more knowledge and you weren't comfortable asking other people because everybody was in a hurry or people are not willing to help in that area. So really specifically how to deal with different causes and, to fix that problem.
I think we probably a lot of the sessions that we've been in, we probably could have an entire specialty session on it in one of our upcoming podcasts. Certainly the one I just came from, which I'll talk in a minute. How about you, Jen? Are you ready yet?
I also can't decide, so I'm like flipping back and
That's all
forth
right.
through my pages. Which one do I want to talk about?
Right, man, that book is full. Look at that.
Well, the infection control sessions have been excellent, all of them. They actually had to move the sessions today because the rooms were overfilling today. There was a lot of people. I think probably the interest in the CAPE exam has really brought a lot of people to this conference, and there was a lot of good discussions, I thought, in those classes. A lot of good tips and tricks, I thought, to improve what you already have as an infection control program. So like I said, I can't choose one. But I did just come from the emergency preparedness talk, which I thought was excellent, and it really made me think, does our plan actually cover everything that could go wrong? Because I think we wrote it, and if we have a hurricane, we're going to do this. If we have a tornado, we're going to do this. And but the question I have in my head is, but what if this what if as a result of this, you have this, and what's your backup plan to your backup plan?
Right. Right. You mentioned earlier EMRs too. We were talking about EMRs. That we really haven't spent a lot of time addressing that. Our whole plan is just make sure you have a bunch of blank pages, medical record pages, in order to document a case. But the situation is much bigger than that.
Well, and EMRs are an up-and-coming thing in the ASC industry, and not everyone has switched over to that now, but we do have to concentrate on the people who do have the EMRs. Do they have the backup plan? Because I know we had downtime in the hospital with our computer system after an upgrade, and it really, affected how we were able to take care of our patients.
Yeah. With Alex, with you, I'm going to have to modify the question a little bit because, first of all, Alex went through 8 hours of life safety training with the two bills.
Right.
Both of them were named Bill. That must have been confusing there. So I'm going to ask you what your favorite session was. But first, I'm going to ask that first, and then we're going to talk about life safety again.
Sure. I mean, the life safety, being interested in life safety, being interested in emergency preparedness definitely has made those two sessions some of my favorites. The life safety ones, what was so great about those is the forms. Just so many amazing resources that both of the bills provided and will provide. Those will be things that we can take back and use for our clients, and all of the people at the sessions can take back and use. The emergency preparedness, again, that one was...
It's all right. We got a bunch of background noise here.
We're in a conference center. That's a busy
That's right.
place. So
We just want you to know that we really are in a live center here.
The emergency preparedness session really had a lot of information, really made us think through how we're going to implement our policies more, how we're going to do drills. It helped me think about how I'm going to lead drills at our centers a lot more. So very thought-provoking.
And what Alex is referring to is one of the things that we've started doing in HS is we're taking our... Sorry, we have to pass the microphone around here. We're taking our clients' programs to the next level where we're actually sending Alex out to do the mock drills with the clients there, which has been extremely effective. Was there another session that have you been in pretty much all life safety?
Well, actually, what's been really fun for me has been just being able to explore the different sessions that are outside of my knowledge. I was in a lot of the infection control ones when I could get in there, when they would fit me in. But, I mean, I'm not clinical.
Yeah.
I know very little about sterilization, about infection control. I do the quality improvement stuff. So this really helped add to my knowledge base in those areas. I went to a session about robotics. Coming to the outpatient centers, that was really interesting.
And growing up, you were very much involved in robotics. So that's
That's part of why I chose it. And
yeah. I'll just speak. Lori, I'm going to sit next to you for a second here.
Oh, God.
So Lori and I serve on the education committee. One of the challenges that I think we have on that education committee, Alex, just make sure the levels are still recording.
Yep.
One of the challenges we have is how do we make sure we have a good mix of sessions that will cover everybody? And one of the issues that we sometimes have is that there's this presumption that nurses come to listen for clinical case things, and that people like Alex and myself who are non-clinical come here to listen to finance and all those things that fall into our bailiwick. And I don't think that's true. I think just like Alex said, he goes out and looks for these things. I've been listening to sterilization for a long time.
I think Lori, as people on this committee, that's one of the challenges that we have to do is to try to make sure that we recognize that not everybody's here for their area of expertise. So Lori is shy. She doesn't usually speak. By the way, when she's out with one of her clients, she certainly has a lot to say. So. But so don't be afraid. Just pretend you're talking.
I didn't do my hair this morning.
Yeah, everybody out there that is listening to us can hear that, can see that, of course. So what was your favorite session so far? You and I have, we don't always get to these sessions because you're one of the big moderators here. But what was your favorite so far?
Well, like Jenna said, all the infection control ones have been good. For any center that has their infection control preventionist, it's a great opportunity for them to learn more and also the networking. But if you do have someone, it would be in your best interest or a very smart idea to invest in that employee and get them certified. And I'm not just plugging the exam because I'm on the committee, but because it's a great thing and it's something that's important and probably down the road that'll be required. So here's an opportunity for that individual to get all the training or a lot of the training or the tools that they need to understand that position and do it well for you, because one infection can bring your entire operation down. But there was also a session that I was at that was in regards to quality, efficiency, cost savings with clinical benchmarking. And I think a lot of clinical people are afraid of QI projects and writing up a study and what should I do. And that was supposed to be all about benchmarking. But the speaker, who was Deb Stinchcomb, was able to let you know that you could take information from your benchmarking studies and turn them into a quality project. And I never looked at it that way, and I've been doing this almost as long as John because he's really old. But it was like, wow, that's a great idea, because we always think that it has to be something wrong. And your benchmarking doesn't necessarily mean you're wrong. It just means you have an area where you can improve. And that's the whole process. So I thought that was a little aha moment.
That's great.
Yeah, I was in that session also, and she did really make it very, user-friendly or whatever, really talked about how it's not that difficult to come up with something, and people are half the time already kind of doing it or talking about it, and they just have to sort of make it official.
So let's lighten things up a little bit. A couple interesting things have happened here at the event, so we'll just kind of tell you some of the funny stories. First of all, I'm on the board of the Ambulatory Surgery Center certification. And as such, I man the booth every once in a while. And my friend Andrew Weiss was at the booth yesterday, and we're just about to start the booth duty. And these three burly guys come up and they say, "We're supposed to remove your booth." Andrew takes his hands and puts it across the booth and says, "You're not going anywhere with this." We had to call up the people in that were taking care of the booths, and Chris Shriver is in charge of the exhibits here. He comes barreling down and he looks at the three burly guys here and he says, "You're supposed to move the curtain, not the booth." And this is what happens when you're charging along doing all these things that we have to do in this. And
Wait, I got a funnier story.
It's not about me, is it?
It is.
Oh, no.
So I went to a session yesterday, and John wasn't the speaker, but he was the moderator. So he introduces the speaker, and does your housekeeping things. Please turn your cell phone off. Be respectful of the people around you, blah, blah, blah. And
I thought I did a great job.
You were fabulous, actually. And he hands it over to the speaker, he was a nice little guy, and he says, as professors do in college, "If I hear your telephone, it's mine." And everybody laughs, ha, 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 whatever. So then we're doing the session, and it's great, and we're about 20 minutes in, and then loud as heck. And John's in the front row going, "Oh my God, it's mine, it's mine, it's mine." He's the one that told everybody to turn him off. I couldn't have been more proud of you.
I tried to explain that I was demonstrating how disruptive that would be.
Go over.
I don't think anybody believed me. So, Judy, you suggested a great question for everybody here, and I think that's a great question to take around the table now too, which is, what's the one thing you can take back on Monday morning and do right away? Since you asked the question, hopefully you have.
What's unfortunate is that I've got 6 of them.
Oh, good.
So
I'll take one.
Oh yeah, I should have wrote them on little pieces of paper. No. again, I mentioned the Joint Commission, and there was quite a lot I wanted to work at with that. But yesterday, I attended a meeting about quality reporting. So I've been trying to help our clients with quality reporting for a while now. And there were two women. I need to look again because I should have been more prepared. There were two very, very knowledgeable women that ran.
Well, probably Gina.
It was Gina and Donna, I think. But I want to give them credit. Credit is due. You know how it is.
Yeah, Donna Schlossberg and Gina Thornberry.
Okay, show off. So you found it before I did.
I just know everybody.
Well, yeah, there's also.
It's all right. I took her microphone away from her, so probably you can't hear her.
So in the last year or so that I've been trying to figure this out and help our clients get it done correctly so that they're compliant, I'm sitting in this session. There were 3 different resources, free resources on the internet that could have helped me all this time that I didn't know existed. Most of which came right from ASC Quality. And I'm in ASC Quality all the time and didn't know they exist. So like the first thing I'm going to do is download those, send the pages that are relevant to our clients that are struggling. We don't have a lot of clients that are struggling. I'll give them credit. But we have a couple, that are climbing the ladder a little more slowly. So that's probably the first thing I'm going to do Monday morning is reach out to those people and say, okay, I think I've solved your problem.
And Judy, actually, just to interrupt for a second on that, the woman over at ascquality.org, I met with her. We're going to do a podcast with her in the future.
Oh, fabulous.
To talk about what her organization does. And I mentioned what we use her information for, which is for benchmarking. So there's so much more, as you said, there's so much more you can do with it.
There's so much more that I didn't even know. I mean, that was my aha. Oh my God, this was always available, and so that's probably the first thing I'm going to work on.
How about you, Sue?
Well, for me, it really, as everybody knows, I'm still pretty new to this. In a couple weeks, I'll be starting full time.
Yay!
So really everything, just a lot of the background accreditation stuff, the different types, the different resources that are out there. And just meeting everybody,
right.
Kind of getting to network a little bit. And so it was just all pretty interesting and a lot of stuff I can use. And
it's a pretty overwhelming event for your first time when you're not. I remember you bringing me. I know we've been with you maybe a month or two when you brought me to the first one. You really are like a deer in the headlights. There's so much to see. Like you almost want to go to every session. Somehow get into every single session. So I remember how you feel.
Yeah.
And there's toys. Everybody gets to win toys.
Yes.
Toys.
So I'm going to give the microphone over to
toys.
So Lori, who didn't want to speak, who has done a great job so far. Lori, do you have something for that you're going to be doing on Monday morning? Well, you were saying that you're going to try to catch up in your sleep, but beyond that.
Other than that.
Well, I guess I'm going to start studying for my exam. Because as much as we think we know things, we don't always know enough. Mm-hmm. So in order to be better for the people that I go out and visit, I want to make sure that I have all the right tools, all the best answers for them. Because one of the things that they pointed out, which you don't think about, is you have to have your staff competent in whatever they do, and that I believe truly that goes right from your front desk person on how they handle patients, families, telephone calls, etc. To your clinical staff. Most of your centers are only going to have one infection expert or sole person in that role that oversees the program. But that person also has to be competent. And in order for them to be competent, someone has to show that they're competent. So in getting the certification, then we can help you with your person in showing how they are competent. And that way, when the surveyors or when the state comes in, it's not because you said so, it's because someone else came in and validated their skills. And hopefully that's what we'll be doing for you too.
Well said. And actually, you're working on a project right now for a brand new client of ours that you're doing that very, very thing. Just what Lori's referring to is that she's going to be one of the first batches of people that are going to go through the CAPE exam.
Oh, good for you.
So we're very excited about it. We took the microphone away from her, but that was only a half-hearted yay there. So, Alex, what are you going to do? I'm afraid to ask this question with life safety. You could be a very busy man.
Well, kind of going off of what Lori said, training and learning more. Oftentimes, after going through these sessions, I realize how much more I need to learn. And that's applicable for life safety and for emergency preparedness. I've been given a lot more resources now, I think, to a lot more information on certifications and training that might be possible for me to pursue and really get a lot more in-depth knowledge on emergency preparedness, on, fire door. There's a training program now on NFPA.
That sounds like a really exciting.
Fire door testing is.
I'll trade you. I'll get to sleep better with you.
Well, it's one of those things. There's always more to it than you think.
That's right. That's right. Okay, Jenna, we saved you for last year. What are you going to take?
I'm probably going to be writing a lot of policies. Well, actually, probably revising policies. We'll put it that way. Maybe writing a couple policies, too. So really exciting stuff as well.
Yeah.
Which, by the way, is her, what is it? Work paradise?
Yeah, professional paradise.
Professional paradise.
Yes.
We've determined that writing policies is Jenna's professional paradise.
We need to have a staff meeting where we figure out everybody's professional paradise.
Yes, it was
so
one
that
of the
we can
general sessions.
foster that.
Yeah, it's one of, as Sue was just saying, that was one of the general sessions that we had. We're actually skipping a general session to do this, so that's probably going to be the best session that was here the whole time. We'll find out afterwards.
But our listeners are more important.
That's right, absolutely. I would just like to finish. I always come back from these things with a lot that I learned. And this is my 29th straight year coming to this event. Wow. Next year will be my 30th year. And
He wants a party.
Let's throw a party.
And Jenna, you'll appreciate this. So I have been coming for 29 years. I have never missed a year. And one year I had to fly home to attend one of her concerts, and I flew back. So that's how dedicated I am, number one, to you. And number two, to this organization.
Thanks,
coming here.
Did you tell the listeners that you are my father, by the way?
I think we mentioned it.
I think just now.
That might be
He's a stalker.
That might be an important
That might have
caveat to
been
that
kind of
story.
creepy.
Yeah, that's a good point. Yeah, especially if they didn't listen to the episode when we talked about that. So.
Not to mention, this can probably be cut, but Jenna is 28 years old. So he's been going to these longer than Jenna's been alive.
Yeah. I just want to, and I did a session yesterday. I do a session here every year on being prepared for surveys. And I have got to tell you, I always enjoy the session. I always get great feedback. Yesterday's session, yesterday's audience, and all of those that are out there listening to us now, that was probably one of the best groups of people that I had. So here's another interesting story. Dr. Shapiro, Dave Shapiro, was representing Triple HC and did the Triple HC session. And Dr. Shapiro, there's no doubt he likes to talk.
More than you?
Almost more than me. So Dr. Shapiro went a half hour over. So he kept those people, I know a couple of you were in that session, he kept people, for 30 minutes afterwards.
He did offer us the chance to leave.
Yes. Well, so Dr. Shapiro and I are always in a little bit of a competition. So I stayed. After my session, and we were there for an hour and 15 minutes. So I beat Dr. Shapiro by 45 minutes.
Well, I think Sue texted me, we might never leave. I wasn't sure if that was a call for help or...
Come rescue us.
But that, it really brings up what this is all about. I mean, the enthusiasm that people have. I mean, we were sitting around talking to some people afterwards. Some people that were new, some people that have been around. I learned something. Sue, you and I were talking about it last night. One of the persons that was in the room mentioned this whole idea we've been talking about of doing a board game for our for disaster preparedness, and it's been an idea we've had. We like playing board games ourselves here, and we thought, well, we'll put this together. This woman did it.
She did it.
She did it.
Yeah.
So, so I don't know who she was. So if that individual would please email us and tell us more about it, we'd love to
If
pass
you're
that
listening,
word out. If you're listening, please help us out.
Yeah, she was
But
very interesting.
the whole thing about this, we'll end. We're at 27 minutes of content already here. We'll have to break this up a little bit. But I do want to say that in addition to all the sessions we go to, and as important as those sessions are, it's the people that we meet here that advance our careers, that advance all of your careers. And the context that you make and the ability for you to call somebody up on a phone, that you've met during this conference, that really makes this. 29 years ago, when I first came here myself, I ran into some of the smartest people, a heck of a lot smarter than me.
That's when we met.
I thought you were rethinking that statement.
But I met a lot of very smart people who introduced me to the industry and introduced me to other people that became important. And I encourage everybody here, whether this is your first year or your 20th year, I am still learning stuff here every single day, every single conference I go to. And please, this has been a great opportunity. Hats off to all the people at ASC Association that have been involved in it. They've been working very hard behind the scenes. I was partying with them last night, and they rightfully had quite a bit of fun. So with that, I think we're going to cut off for now. We do have some other material that we'll put in here, but thank you, everybody, for taking some time out of the conference to talk. And I think this is the point where we say we're going to take a short break, and we'll be back.
I understand you have a special offer for our listeners this week.
Yes, indeed we do. So as a special offer for all of our listeners on this podcast, we're offering a significant discount on my book, The Survey Guide for ASCs, a guide to the CMS conditions for coverage and interpretive guidelines for ambulatory surgery centers. This book, as hopefully everyone knows by now, is the leading book in the industry for preparing for a CMS survey. Has a lot of information about what the regulations are, the interpretive guidelines, and really has a nice index to be able to find this information quickly. I find it's particularly helpful for those difficult questions we sometimes get from the physicians when they say, okay, show me the regulation. And they can pull this book out and go right to that section very quickly. So in order to take advantage of this deal, go to the ASCPodcast.com website, which is ASCPodcast.com. And follow the link for this week's episode. You will see a link to purchase the book.
And how long is this offer available?
You can purchase this book at this discount through April 30th.
Thanks, John. So please head over to our website, ascpodcast.com, to take advantage of this great offer.
So let's talk about some upcoming events in the ASC industry. Every week we will inform you of upcoming events. If you would like your event to be included in the podcast, please send the event information to info@ascpodcast.com. And note that we also have a calendar of events on our website at www.ascpodcast.com. It's still under construction and information is being added pretty regularly now.
The New York State Association of ASCs has its spring conference coming up at the Desmond in Albany, New York, May 17th and 18th. And the New Jersey Association of ASCs has the 8th Annual Ambulatory Surgery Conference on June 12th and 13th at the Wilshire Grand Hotel.
Becker's 16th Annual Future of Spine and the Spine, Orthopedic, and Pain Management Driven ASC Conference is June 14th through 16th, 2018 at Swiss Hotel, Chicago, Illinois. Registration for the online CAPE exam that will be administered during the month of October at various testing centers throughout the United States is August 1st through 31st, 2018. To register, go to www.aboutcape.org. That's www.aboutcaip.org.
The California Ambulatory Surgery Association has the CASA Annual Conference September 5th through the 7th, 2018 in Huntington Beach. The Ohio State Association meeting will be September 18th through the 20th at the Hilton Polaris in Columbus, Ohio.
The CASA Infection Prevention Seminar, November 7th and 8th, 2018 in Costa Mesa, California. Registration for the online CASC exam that will be administered during the month of August at various testing centers throughout the United States is May 1st through 31st, 2018. To register, go to www.aboutcasc.org. That's www.aboutcasc.org. Another testing period is in October 2018, and registration for that exam will be August 1st through the 31st.
If you'd like to have your event listed on the website and discussed on the air, please email us at info@ascpodcast.com.
Well, that's it for this week's podcast. Please join us again next week for another episode of the ASC Podcast with John Goehle. Please make sure you take advantage of the special deal for John's survey guidebook. For a discounted rate, go to ascpodcast.com. Don't forget to tell your friends and colleagues about the podcast and hit that subscribe button so you don't miss a single episode. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all the rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute, legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development, all rights reserved. We would like to thank this week's sponsors, Ambulatory Healthcare Strategies, one of the nation's leading regulatory compliance and financial oversight firms. For a free consultation, contact John Goehle today at 585-594-1167 or through email at info@ah-strategies.com. Our other sponsor today is Eden Group Development, which publishes ASC Regulatory Compliance Series, the ASC industry's leading books, including the Survey Guide for ASCs, a guide to the CMS conditions for coverage, and interpretive guidelines for ambulatory surgery centers, and Ambulatory Surgery Center Governance, a guide for ambulatory surgery center owners and governing body members. These must-have books are available on Amazon and Barnes & Noble or directly from the publisher at reg-books.com. That's reg-books.com. If you are interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.